Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Kenya Eddings, and she is the director of the Arkansas Minority Health Commission. Kenya, thank you so much for being here.
Thank you for having me. It's an honor to be with you today.
So we're talking about Men's Health Month.
Yes.
And why is this observance important, particularly for Arkansas communities?
Absolutely. Great question. Well, June is National Men's Health Month. We know that for all men, we experience here in this state a 7-year decrease in life expectancy for men. And so we know that that is time lost with loved ones, that's time lost with friends, time lost with family members, and that's time we can't get back. And so that's why it's so important for us to shine a light on men's health and bring awareness, and so we can do something about it.
So what are some of the most pressing health challenges facing men in Arkansas today? Is it different here than other places?
So it affects us more. So we know that heart disease is the #1 cause of death for all Americans. We know that cancer-related deaths have increased, particularly with men, and we're talking lung cancer, colon cancer, and prostate cancer. Those have a tremendous effect on life expectancy for men. And then we also know that tobacco can contribute to that. And so, and especially mental health awareness, stress, and mental health disorders also have an effect on men. And so that's why we want to shine a light on men's health.
And data often shows significant disparities in health outcomes among men of color. What trends, concerns is the Health Commission monitoring closely?
Yeah, so I mentioned heart disease, but we also have really paid attention and honed in to cancer and cancer-related deaths. Again, lung cancer, particularly devastating to men of color in the state. Colorectal cancer also has a deleterious effect on men. And then also prostate cancer. I think it was said that prostate cancer will be probably #1 in advance of lung cancer and colon cancer. So we know that that has a lot to do with access and a lot to do with screenings. And so we really want to pay attention to that and get men to be aware that screening is out there. It's important to get screened and that they actually do it.
That was my next question, is they actually do it, because there's a little bit of fear, I think shame or embarrassment to have those tests. Is that a part of what you're seeing?
So not necessarily shame, but fear for sure, the fear factor. No one wants to have bad news. But it is important for us to convey as public health professionals and providers that the sooner you get in there and the sooner you find out your results, the better your outcomes will be. So early detections give better results. And so we just want people to know that, how do you know what the results are if you haven't been screened, if you haven't been tested? So it's important for us to get screened.
And daily preventive care is also a part of that.
Yes.
What barriers prevent men from seeking? I mean, you touched on this a little bit. Wellness visits, all of those things are a part of this that are important.
Yeah, so often we hear that men are so busy trying to take care of themselves, take care of their families, and that means that going to work every day, not taking off work to go and get those preventative health screenings, because let's face it, prevention saves lives. But men are of the type that, you know, if I don't feel it, it's not affecting me. But sometimes that's just not the case. And so we want to hone in to men that it is important to get those health screenings, those annual health screenings. And if something doesn't feel right, not to ignore it, but to get yourself seen. as quickly as possible.
And how can healthcare providers and community organizations work together to address the issues like chronic disease, mental health, those things that you mentioned?
Yeah, for number one, just talking about it, having conversations about it. Oftentimes, men feel like that it doesn't affect them, that heart disease does not affect them, cancers don't affect them, and so they are not participating in the conversation. Boy, it's so important for us to have those conversations, and not just women to men, but men having conversations with each other, particularly those with lived experience. Someone who is a cancer survivor can better connect with a man than someone like me or you can, because they have that lived experience.
So for viewers who might be unfamiliar with the Arkansas Minority Health Commission, can you share what the mission is and what do you do?
Absolutely. For 35 years now, we have been standing in the gap as it relates to preventive health screenings, preventive health services. We want to make sure that all Arkansans, regardless of their race, their socioeconomic status, their sex, have the best health outcomes that they can. And that's what we do. We travel to all 75 counties, providing chronic disease screenings. We do mostly diabetes checks, high blood pressure checks, cholesterol checks. We have a couple of partnership with community agencies that allow us to go above and beyond chronic disease screenings. And so again, we want people to have the very best health outcomes so that they can live their best lives. And so that's what we do all day, every day.
And with men, what are
Yes.
specific programs that are happening for the month of June? It's
Yeah.
not just June.
No. So we are excited to announce our inaugural Men's Health and Wellness Fest. It's not just, something that we come together and learn. We do want men to learn, but we want to make it a fun activity. We know that in order for men to learn, they have to have fun. And so we want to include fun into the days. So actually just this past weekend, we had our inaugural fest for Hispanic and bilingual men, which was very successful. We're getting ready in a couple of weeks to host one for all comers, English speakers, African American men, our white brothers, Chinese, Asian, anyone. Just come on out and join us on June 27th. We're going to be talking about heart disease. We're going to be talking about colon cancer, prostate cancer, all things that affect men, physical activity, mental health, healthy eating. We're going to be teaching men how to prepare some healthy snacks. Lots of times men just like to graze like most people, and sometimes it's not comfortable on the waistline. So we want to help men specifically to enjoy a snack here and there, but be healthy about it.
And are there partnerships with healthcare systems, of community organizations,
Yeah.
faith-based groups that have been especially effective in reaching men where they are?
Yeah, as a matter of fact, thank you for that question. As a matter of fact, we have partnered with the City of Little Rock for the past few years. They have inaugurated something that's called Midnight Basketball that reaches young men ages 16 to 25. And so all throughout the summer, every Friday and Saturday, men can come to the surrounding community centers and play basketball for free of charge. And this is a way of getting young men something to do late at night on the weekend so they're not getting into trouble. We've partnered with them for the last 2 or 3 years now. And so we're excited to partner with them again. What we do is go in, provide health screenings, free health screenings, and then have just conversations about health, the importance of getting health screenings, the importance of talking to someone if you're not feeling good. And we've just learned that this year, the City of Little Rock is expanding. So not only are they doing Friday and Saturday throughout the whole summer, but they're doing Thursday, Friday, and Saturday. So that lets you know that the need is great, the program is growing, and it's really popular, and we're glad to be a part of it.
And what are you said the community centers throughout the city?
Yeah, all the City of Little Rock's community
Okay.
centers. So that's Jim Daly, the Southwest Little Rock Community Center, the Dunbar Community Center, and I think there's a couple of others. But Thursday, Friday, and Saturday evenings throughout the summer, they will be open. And we'll be there talking to the men about good health.
Well, and my next question, which really, that is a good example of a program, a success story of community impact that really demonstrates how the commission is making a difference in men's health.
Absolutely. Now, I'll point out another example. We've been partnering with 3M Factory, which is located in Southeast Pulaski County for the last 3 or 4 years now, on their annual health event. They particularly employ lots of men. I want to say about 95% of their workforce is men. And so we've been going out every year providing health screenings and health referrals and education to all the men that come through. It's been so successful for us that not only did we start with their first shift, but then we've expanded to doing their second shift. So we're covering about 95% of all the men that work there. We're able to really spend time with them, to talk to them and educate them about what their numbers are as it relates to high blood pressure, high blood sugar, what those numbers are, what normal ranges mean, and refer them if needed to get some additional healthcare services.
So this is not just even Central Arkansas too, as you mentioned, far reaching to every county in the state.
Absolutely, all 75 counties, and we're thankful that we've been able to travel to all 75 counties at least once each year.
So what role do healthcare providers play in building trust and improving engagement among men who may be reluctant?
So I think number one, the first thing to do is to have that conversation and to acknowledge that there may be some trust issues. But as healthcare providers, healthcare practitioners, it's our jobs, it's doctors' jobs to reassure the men that they are treating that, hey, it's confidential. My visit with you is totally confidential. I am only here to help, to get you to the next level so that you can be the best version of you for yourself and for your family.
So for our audience, much of our healthcare community, stakeholders, even policymakers, where do you see the greatest opportunities for collaboration are to improve men's health?
Absolutely. So I think that more important to just reaching men where they are right now is reaching down to the younger generation, the young men, the young boys who are coming up now, who really are not necessarily paying attention to their health. They just want to go out and play and hang out with their friends. But if we can drive it home now that they need to pay attention to their health right now, then we won't have to diagnose them with diabetes or hypertension or high cholesterol when they're in their 30s and 40s, or sometimes even younger. We are seeing young men particularly being diagnosed with high blood pressure, diabetes, and cholesterol. And these are all things that can be prevented. And so prevention is worth $1 million. And so if we can get those young men and those little boys to pay attention to their health, then I think we would save a generation.
So on that note, what resources or support does the Commission offer to healthcare organizations, even community partners, that can leverage to advance health equity?
Yeah, so partner with us. Partner with your Arkansas Minority Health Commission. We say that it is your Arkansas Minority Health Commission because it does belong to everyone. Again, we serve all 75 counties, and it's important for us to reach people where they are. And we do that through several ways. We have a mobile health unit that has 2 full-size exam rooms on it. We take it all over the state. It is fully ADA compliant. So if someone has mobility issues, they're in a wheelchair, they're on crutches, they're on a walker, we have a lift that will lift them up into our unit and we can serve them. We offer a private screening room so that when we have to have those challenging conversations, sometimes you do have to have tough conversations. We can do that in the privacy of a meeting room or a private consultation room. So we take it all over the state.
Is it free?
It is absolutely free, totally free of charge. All someone has to do is give us a call, 501-686-2720, and we'll get them scheduled.
So what strategies are important for increasing participation in preventive screenings? So those blood pressure checks, those diabetes screenings that you're talking about, why is it important to increase that participation?
Absolutely, because we know that, again, Heart disease is the number one cause of death for all Americans. And we know that people who suffer from heart disease or have challenges with heart disease have a decreased quality of life. And we want to improve everyone's quality of life. And we do that by encouraging people to get their screenings, get screened for diabetes, get your blood pressure checked, get your cholesterol checked. So that way, if there's something that's kind of out of whack, we can help you work on that. We can make some referrals to healthcare providers that can help you. We can help you work on your healthy eating habits through our Southern Ain't Fried Sundays healthy eating program that is totally free of charge to participate. Everything that we do is free of charge for people. And so there's no money out of pocket. We are your cheerleaders. We want you to have the best health, particularly our men out there. We want to cheer them on to good health. And so just give us a call at 501-686-2720. We're happy to come to your neck of the woods.
So many incredible programs, really cool partnership opportunities.
Yes.
So as we go,
yes,
what's the one message that you'd like men across the state to hear about Men's Health Month, but just in general that you would like to leave them with?
I want all men to know that taking charge of your health is not a crutch. It's not a sign of weakness. It's actually a sign of strength. And so being able to speak up, to speak out about if something is not right with you or your body or the way you're thinking, getting help is a sign of strength. So don't look at it as a sign of weakness. So if there's something that the Arkansas Minority Health Commission can help you do, give us a call, 501-686-2720.
They're going to remember that phone number for sure. And there's a website.
Absolutely, arminorityhealth.com. arminorityhealth.com, and follow us on all of our social media channels. We're on Facebook, we're on X, we're on Instagram. So follow us and see where we're going to be. We might be in your neck of the woods. So yes, just reach out.
Well, thank you so much for being here today and talking about these important programs. I appreciate you.
Thank you. Thank you for having me.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.